On behalf of the Wellbeing Collaborative, I want to welcome you today and thank you for making the time to be here with us. You, your colleagues, are the lifeline for access and quality of health care across the state of Arizona. And if we don't care for each other, there will not be quality care, there will not be access to care, there will not be healthcare institutions for our neighbors, our loved ones, our friends to go to in the future.
So our focus today and really what we're going to be learning is how to support humans. We are all humans and we all need support. So today we are going to learn about the importance of peer support and why it's a program that's really essential for organizations in order to make sure that they're creating a culture of care.
There is a long historical culture in healthcare that really deterred healthcare workers from seeking help.
We know statistically speaking that healthcare professionals don't reach out for help. There's a stigma that's still attached to that.
The Wellbeing Collaborative has done a tremendous amount of work to remove that stigma. A lot of what they've done is the Arizona Medical Board has already removed all of the questions from its licensing process. And when a healthcare worker knows that they're going to have to answer a question about whether they've sought mental health care, they are less likely to seek that mental health care unless they know that they can be safe and that they will not be questioned for having sought the help.
People are more likely to reach out to a peer for support than they are to call EAP, call a psychologist, and even go see a therapist.
So if we train the folks in the field and we can turn to our own peers, and those peers are at least trained and aware about the resources available, they can help them find and get to the right resources that they need for their situation.
Having a person that you can lean on to say, hey, I need a different perspective on what's going on. I'm feeling a little overwhelmed at this moment. I'm feeling a little out of sorts. I'm feeling like I'm striving and we're getting nowhere. Can you give me a different perspective?
What it's not is therapy. It's definitely not a replacement for any type of mental health or behavioral health services. And it's designed to not replace anything that someone is going to need in order to be able to work through longer term issues or circumstances.
It's so important for the whole community that our healthcare workers and our public health system and our educators are motivated and want to stay in the workforce, and that young people want to enter the workforce. So the more systems we have in place to keep people feeling good about the work that they do and being able to access the resources they need to keep up that good work, the better off our entire community will be.
Coming to this is inspirational. It helps you build the community that you may not have. Coming to this space is vital. We need to have this space, especially during the time, so that we can build community.